Ladies and gentlemen, our second keynote speaker is Her Royal Highness Princess Muna al-Hussein of Jordan, who has dedicated much of her life to helping those who help others. In 1962, Princess Muna helped found the Princess Muna College for Nursing. The college is now part of Mutta University in Jordan. Among her various accomplishments, Princess Muna led a successful initiative that resulted in the establishment in 2002 of an independent nursing council. As president of the Jordanian Nursing Council, she has worked to reform the nursing profession and has established strong ties with prominent nursing and health institutions. We will now hear a video message from Her Royal Highness Princess Muna al-Hussein.
Your Excellencies, distinguished delegates, ladies and gentlemen, greetings from the Hashemite Kingdom of Jordan. I congratulate the members of civil society and non-governmental organizations for selecting the theme, Advance Global Health, Achieve the MDGs, for your annual conference. Your approach of emphasizing health, not management of disease, sets the tone for a more inclusive dialogue within and beyond the health sciences. It promotes interdisciplinary collaboration and emphasizes transnational health issues of economic development, human rights, human security and dignity, climate change and disarmament. Ladies and gentlemen, the world is changing. We are interconnected to an unprecedented degree. Mobility, migration, and global markets are becoming facts of life. This brings opportunities and also vulnerabilities. Today, we have, more than in any other time in history, the experience and the most sophisticated technologies for treating disease and prolonging life. Yet the gaps in health outcomes and in equity keep getting wider. In addition, people living in poverty face problems beyond those targeted by the MDGs. The World Bank estimates that 1/3 of people living in poverty in developing countries die prematurely from non-communicable diseases because they are more exposed to different risk factors, coupled with health services less responsive to their needs. In developing countries, people lose their lives because of poverty, poor nutrition, inadequate education, lack of skilled healthcare providers, poor sanitation, and contaminated drinking water. Less than half of the women in some developing regions are attended to by skilled health personnel when giving birth. Life expectancy can vary as much as 40 years between developed and developing countries. UN Secretary-General Ban Ki-moon, in his foreword to the MDGs report, June 2010, states, "It is clear that improvements in the lives of the poor have been unacceptably slow." Other findings include only half of the developing world's population has access to improved sanitation. The safety of water supply remains a challenge and urgently needs to be addressed. We need to make greater efforts to achieve the Millennium Goals 4 and 5, which aim at reducing child and maternal mortality. Ensuring proper nutrition and adequate sanitation is a critical aspect in the prevention of childhood pneumonia and diarrhea, because malnutrition increases the risk of death. Inequities in maternal care still persist. Maternal mortality is the highest in regions where care by skilled healthcare providers, adequate supplies and equipment is the lowest. More than 1/3 of maternal deaths are due to hemorrhage, could be prevented or managed through a range of interventions administered by skilled healthcare providers. For the first time in human history, the majority of the world's populations live in cities. About 1 billion survive in urban slums and informal settings. Natural and man-made crises have increased and might affect anyone, anywhere, anytime. So, what is the response? Governments will be more successful in achieving the MDGs if they incorporate human rights principles into national development strategies. This action is a proactive measure to counter discrimination and remove obstacles that prevent the poorest and the most marginalized people from accessing basic health services and remedies. Non-governmental organizations should be involved in monitoring and evaluating national strategies to achieve the MDGs. These groups represent the communities that will benefit from the achievement of the MDGs. Number of health workforce. 57 countries face a severe health workforce crisis in nursing and midwifery. Strengthening health systems through a revitalized approach to primary health care. Revitalizing primary health care will organize health services to meet community needs, integrate health into all public and private sectors, and deliver cost-effective and sustainable care with an emphasis on prevention. Using this effective health delivery model will extend the reaches of services while managing scarce resources effectively. Develop and implement more programs to ensure adequate sanitation. Sustainable access to adequate sanitation and safe drinking water is crucial for the basic health of all. Ladies and gentlemen, I support your notion that the global health is not just management of disease, rather it places a priority on improving and achieving equality in health care for all. Further, we need to generate and develop methods to evaluate outcome data. Achieving global health and MDGs requires addressing the challenging, multifaceted issues in multidisciplinary ways. The responsibility rests heavily upon governments who must increase their efforts to provide better health and education services and to empower women in efforts to save the lives of children and prevent maternal death during or as a result of childbirth. I believe that you, civil society, and non-governmental organization, in collaboration with governments and policymakers, are vital agents for a positive change in global health and achieving the MDGs. Stay committed to the value of social justice, equity, and quality health care for all. I would like to congratulate the organizers of this conference on both sides of the globe for providing a forum for civil society to come together to discuss a topic that is basic to the human condition. Thank you.